Phyllis Wheeler is walking and talking, as opposed to in a nursing home being fed because somebody grabbed the bull by the horns.
So my day began just going to work at the animal hospital and just deciding there about 4 o'clock or so I was going to go to watch my granddaughter play basketball at Lawrence Free State High School. And so I left, and the girls at work would ask me, "Don't you remember anything about that?" And I said, "No, not too much about leaving work, or even driving down 6th Street, going to the thing. I do remember parking and going in, and once I got in there to get my program and stuff, that I guess that was when I fell over."
So we're just sitting in the training room, normal day, getting ready for basketball games, and somebody comes running in that an older lady was having a seizure in the front of the gym.
And I don't remember grabbing my chest or feeling any pain or anything, just blacked out, I guess.
So we come running down there. She has collapsed, so she is kind of convulsing at first. So we're just kind of, in that kind of situation, you just want to kind of protect her head and make sure she's not hurting herself and people are out of her way. Then we found out that her breathing kind of stopped and her heart rate was unresponsive. So that was when we get the AED and get our equipment kind of ready to go to perform CPR. And
we know that as soon as someone's down and there's no pulse, CPR should begin. That's what you learn in a CPR class. Early CPR saves people's lives. So that's part of the reason Phyllis is still alive too, is the early CPR.
And thankfully we had an amazing, super fast EMS response. So right as we were kind of getting ready to do all of that, they got there as well.
She regained spontaneous circulation. She was brought to our emergency room. EKG showed that there was a cardiac problem, but her white count was up and she had a low-grade fever and her chest x-ray was abnormal. So in medicine we make a grocery list called a differential diagnosis. If you look at all of the data, what are the things that would fit into those bins? And the 2 things that would fit, or 3 things that would fit, would be, number 1, she had a cardiac arrest on the basis of a blocked artery, and that's why her EKG is abnormal. Number 2, maybe with the abnormal chest x-ray, she's got pneumonia. And number 3, because of that pneumonia, she's got sepsis, or she's got bacteria floating in her bloodstream. And sepsis could make your EKG abnormal. Sepsis could give you a cardiac arrest. And sepsis could paint this whole picture.
I think Phyllis, is a great example of early intervention is key and time is everything when it comes to heart attacks and heart disease. So she was, obviously it was witnessed arrest that happened. So that's huge because then the CPR can start right away. Fortunately here in Lawrence we have a cath lab and we have heart care that she came to quickly and got her intervention by Dr. Dreiling quickly.
We bring her down to the lab on the ventilator and do an angiogram, and we find she has a subtotally stenosed left main coronary artery. And that is a widowmaker, or in this case, widower maker. I mean, if she would have lost that left main, she wouldn't have survived, and it was hanging on by a thread. So now, in retrospect, with me in the room, I can collate all the information and put the puzzle together. What transpired was she had a subtotal stenosis of the left main and didn't recognize it. A very good case of you can have death-defying cardiac disease and not have a squat worth of symptoms.
I mean, I've never had any pain in the arm or anything like that, and just no, heart problems. I have high blood pressure, and that was being treated, but nothing that, just a shortness of breath, maybe out in the cold weather and stuff. So
the reality is you can have significant disease and not know it. That's the bottom line.
You kind of have 2 types of patients, those that have symptoms with activity for some period of time, and that's how they get to us, but you also have the people who have a sudden event, and they have no necessary warning.
She had critical atherosclerotic narrowing of that, so the cholesterol buildup, if you will, got smaller and smaller until she had a little pinhole, and yeah, it would get her by, and she could get by with average daily living, but get her into a gym, get her excited, and give her a little bit of mycoplasma pneumonia, and there's enough ischemia, lack of blood supply, lack of oxygen to the heart, that the heart says, okay, I'm done, I give up, and down you go.
So Phyllis's heart functions back to normal, and that's because we saved the muscle early. She got early CPR, early intervention, and we were able to save the heart muscle by opening her artery.
Once you give blood to the heart, it kind of just takes a big sigh of relief. And we barely had that stent in, and her blood pressure started to come up, and we got her off her pressor agents and her norepinephrine. And so at least we knew heart-wise that this was going to come back.
And in the end, what I think is great is that everything happened in Lawrence. We had it all available here for her to save her life. And then when I saw her as a follow-up, we reassessed everything, and now her heart is back to normal, which is huge for her prognosis going forward. So because we were able to get to her so fast, and because people on the outside of the hospital got to her so quickly as well, we saved her heart muscle. So that's huge, you know, that the timing of things is really, really important.
If there's any hero in this story, it's whoever was doing CPR, because you can frequently save the heart, but you can't save the brain. Without CPR, she would have, you know, she may have regained spontaneous circulation, but she may not have regained her brain. So the fact that there was CPR is what makes it so that she can talk and walk and think and have personality.
Yeah, I feel like as long as you've had that training, you never know when a situation like that's going to happen, that really just don't hesitate. You really have to do, if you're able to help somebody, really just no hesitation, do it, because it really is the difference between them living and not.
But the value of the American Heart Association is education and awareness. I mean, they support not just the care of the patient who has a cardiac problem, but also prevention, awareness, education, and also other parts of the care of a patient too, CPR and EMTs and, you know, all the things that go into helping save a person's life, not just in the care of a cardiologist.
The statistics would say if you have an out-of-hospital cardiac arrest out of the hospital, your chances of surviving and going home intact are less than 10%. And the fact that she's walking and talking and carrying on a normal life is a miracle. It's just a miracle.
That's all I had was shortness of breath, and that was the only warning I had. So, you know, follow through with that. Check out and see what's going on.
I think with cardiology and heart disease, we just, especially women, we need to know our numbers. And I know that we've said that before, but that's still the case. There's still a large portion of people that don't know their risk for heart disease, and particularly women. So I think understanding your numbers, your cholesterol numbers, your blood pressure numbers, if you have diabetes or not, your weight, a good weight, and then getting tricks of the trade of how to improve those things, or if you need a doctor's help for that, but seeing your doctor on a regular basis in order to know your numbers and know your risk. That's the biggest thing.
I am very thankful to be here, and I would so appreciate if everybody could help support the American Heart Association and the CPR, and that's what saved me. And I'm just thankful to be able to be here and speak with you.